Queensland scientists have raised hopes of a world-first antiviral treatment for COVID-19, which they say has the potential to stop the disease attacking the lungs and prevent patients dying from a lack of oxygen. Researchers from the Menzies Health Institute Queensland and their American partners have developed technology which they say seeks out and destroys the virus.
But the breakthrough has been tempered by new figures which reveal a quarter of available COVID-19 vaccines in Australia have not been used. Let's get more from our reporters, Michael Rennie in Brisbane and Matt Doran is at Parliament House in Canberra. Hello to both of you. So, Michael, how significant is this new antiviral research out of Queensland?
Well, Lisa, it could prove to be very significant, and researchers have actually dubbed it a seek and destroy mission, a very American term, but it's because it's proving to be extremely effective. So in the research that they've done on mice, it's reduced or removed 99.9% of viral load in those mice. So very effective so far. This is a joint venture between researchers from the Griffith University, where I'm at this morning, and also from a US team as well. So basically they're using what's known as next generation gene silencing technology. Very, very different from traditional treatments of viruses. So say something like the Tamiflu, it's used to actually treat your symptoms and make you feel a little bit better as you go along, where this actually attacks the virus directly and then stops it from replicating. Researchers, though, stress this is not a cure, but being 99.9% effective, it could be used as another valuable tool in the fight against COVID, particularly for people who are already in intensive care units where the vaccine is just too late for them. It could stop them from dying from this virus. And the way it would be administered would be via an injection over a 4 to 5 day period. And Lisa, they're saying that this could be ready to use by 2023.
It's good news, Michael. But Matt, in Canberra there, we've seen new figures revealing that Australia isn't using all of the available vaccines that we have.
That's right, Lisa. Good morning. These figures were released by the Federal Department of Health yesterday, and it shows that there are 1.5 million doses of a coronavirus vaccine sitting in fridges across the country. 1 in 4 of the doses that have actually been delivered not yet having been used. When it comes to how the states compare, Tasmania is leading the nation. It's used around 90% of its supplies, whereas the Northern Territory is at the back of the pack, using only 58% of its supplies. And Commodore Eric Young, who is managing the vaccine rollout, says that there was a drop-off in the utilisation rate, that is the number of doses that have been delivered as opposed to those that have been administered, after that updated health advice was issued regarding the AstraZeneca vaccine, that Australians over the age of 50, that was going to be the vaccine for them, whereas the Pfizer vaccine would be the one chosen for Australians under the age of 50. He said the utilisation rate did drop off after that health advice was issued, but it has started to pick up again. And we're currently looking at these figures across the nation of more than 3.1 million doses of coronavirus vaccines having been put into Australians' arms so far. Of course, it is a 2-dose situation, so that doesn't mean that there are 3.1 million Australians fully vaccinated yet, but it is adding to this debate about internal borders and the further easing of restrictions across the country. Prime Minister Scott Morrison saying he doesn't want to see Australians who are fully vaccinated be locked out of certain parts of the country if there are COVID outbreaks into the future. For example, someone's in Sydney, there's an outbreak, he doesn't want to see that person locked out of a place like Darwin or Perth if they have been fully vaccinated. It's received a sort of mixed welcome or mixed response from some of those state and territory leaders. Each have a different idea as to what vaccination levels will need to be at for those restrictions to be eased, but it's a debate, a perennial one it seems, that won't be going away anytime soon. Lisa?
Matt, Michael, thank you.